Let me ask you a question. Have you ever thought, I'm ready to retire, I've saved enough, I've done the work, but then one giant fear stops you cold? Healthcare. Because retiring at 55 or 60 sounds amazing until you realize Medicare doesn't kick in for another 5, 10 years until age 65. And suddenly you're staring at premiums like, wait, I have to pay $1,000 a month just to have insurance? Now, if that's you, stay with me because today I'm going to walk you through the real strategies people use to retire before 65 without healthcare destroying their retirement income. And we're not doing vague answers. We're talking real options, real numbers, and real planning. Now, quick favor before we dive in, if you're in your 50s or early 60s and you're trying to retire with clarity and confidence, make sure you hit that subscribe button down below. This channel is all about building reliable retirement income, protecting your principal, and making retirement feel exciting again, not stressful. All right, let's talk about the biggest retirement gap nobody prepares for: healthcare before Medicare. So here's the deal. Medicare starts at age 65. That means if you retire at, let's say 55, 58, 60, or even 62, you have 5 or 10 years before you can be eligible for Medicare. So where you need coverage on your own is those gap years. And this is where people get blindsided because they'll say, I only need $5,000 a month to live on, but then the healthcare comes in and adds $800, $1,200, sometimes $1,500 a month. That's not a small expense. And for many people, it becomes the number one reason they delay retirement. Not because they can't retire, but because they don't know how to bridge the healthcare years. So let me give you some clarity. There is no magic plan that makes healthcare free, but there are strategies that can reduce the cost dramatically. If you know how the system works, and most people don't, it can really benefit you. So let's break it down. Let's talk about option number one, the classic Affordable Care Act marketplace, or ACA marketplace. This is the biggest one, and it's also the most misunderstood. When people hear marketplace plans, they assume that's expensive or I won't qualify. But here's the truth. Marketplace insurance is based on your taxable income, not your net worth. Let me say that again, because it's huge. It does not matter if you have $500,000 saved or $2 million or $100 million saved or a paid off house or a large brokerage account. What matters is how much income shows up on your tax return. And that's where retirement planning becomes healthcare planning. Because if you retire early, you may actually have lower taxable income than you were when you were working, which can unlock something called premium subsidies. These subsidies can reduce your healthcare costs by hundreds, sometimes over $1,000 per month. Let's do a simple example. 2 retirees, both age 60, both need health insurance. Both live in the same state, both want the same type of plan. Retiree number one pulls $90,000 a year from their IRA. Now that's taxable income. Their premium might be $1,200 a month, whereas retiree number two only pulls $45,000 a year and supplements the rest with Roth savings or after-tax accounts that might not have any taxes on it. Their taxable income stays lower and their premium might be $300 to $400 a month. Same insurance, same plan, same age, massive difference. The difference is not luck, it's the income strategy. So if you're retiring before Medicare, the ACA marketplace is often the best tool available, but you have to plan withdrawals carefully. Now, this is something that we have nicknamed the broke millionaire strategy because you're trying to keep your income low enough to be able to get on these subsidies, but you have a lot of money still saved. Now, quick question. Did you realize your healthcare cost could depend more on your income plan than your savings? Now, make sure to drop a comment below. What age are you hoping to retire? I read every single one, and I hope to answer as many as I can. Now, here's what happens. Someone retires at age 60, they have money saved, but they do something totally normal. They pull a big chunk out of their IRA, or they cash out investments, or they sell property, and suddenly their taxable income spikes. And when income spikes, ACA subsidies disappear. Premiums skyrocket. So they conclude healthcare is impossible. No, the problem is the withdrawal strategy. This is why retirement income planning isn't just about spending. It's about controlling taxation, because taxes affect your Affordable Care Act premiums now, they control your Medicare premiums later, Social Security taxation, and your long-term retirement stability. Healthcare is connected to all of it. Option number 2 is COBRA insurance. COBRA allows you to stay on your employer-sponsored plan after retirement for up to 18 months, sometimes longer. In special cases, COBRA is often expensive because now you pay your portion, the employer portion, plus admin fees. So yes, it can easily be $800 to $1,200 a month. But COBRA is useful for one big reason. It buys time. It's a transition strategy. For example, retire at age 63, use COBRA for 18 months, and then Medicare starts at age 65. That's a clean bridge. So COBRA isn't the long-term solution, but it can be the runway. All right, option 3, part-time work with benefits. Some retirees don't fully retire, they semi-retire. Not because they need the income, but because they want the benefits. There are jobs that offer healthcare, even at 20 hours a week, seasonal work or consulting roles. And when healthcare is covered, your retirement income stays intact. So sometimes the smartest move is not work forever. It's work lightly, strategically, for benefits. That's a very different mindset. A quick question. If someone offered you a part-time role with full coverage, would you do it for a few years to retire early? Comment yes or no below. I'm curious. Option number 4, health sharing plans. You may have heard these, but they are not technically insurance. They are groups that share medical expenses. Some people use them because premiums can be lower, but there are some risks. Not regulated like insurance, coverage exclusions, no guarantee of payment. So I always tell people these can work for some, but you want to be very cautious. Read everything and don't assume it's the same as insurance. Option number 5, the HSA strategy, the health savings account. An HSA is one of the best tools out there. It has triple tax benefits. Contributions are tax deductible, growth is tax free, and withdrawals for medical expenses are tax free. That makes it a retirement healthcare powerhouse. If you built up an HSA during your working years, you can use it to cover premiums, prescriptions, deductibles, even long-term care expenses. It's like a retirement account specifically just for healthcare. And healthcare is one of the biggest retirement expenses, so HSAs do matter. Let's bring this home. The question is not just, how do I get insurance before Medicare? The deeper question is, how do I create income or retirement income in a way that keeps healthcare affordable? That's the game. Because early retirement isn't just about assets, it's about strategy. A good plan coordinates your taxable withdrawals, your Roth withdrawals, your brokerage withdrawals, your ACA subsidy thresholds, and future Medicare costs. That's how you retire with confidence. Not guessing, not overpaying, not panicking. So if you're in your 50s or early 60s, here are your next steps. Step 1, know your retirement age target. Are you retiring at age 55, 60, or 62? And then step 2, estimate your healthcare gap. How many years until Medicare? Step 3, explore ACA options in your state. Don't assume it's unaffordable. Step 4, plan your income carefully. Your taxable income is a lever. Step 5, build a bridge strategy. COBRA, ACA, part-time benefits, HSAs. Most people use a combination. Let me leave you with this. Retiring before 65 is absolutely possible. People do it every day. But the ones who succeed don't just save money, they plan intelligently. Healthcare is not a reason to give up on retirement. It's just a reason to build the right bridge. If you want a clear income plan that protects your principal, manages taxes, and keeps healthcare costs under control, that's exactly what we do here at CFG Retirement. So make sure you subscribe, and if you'd like to learn more, you can check out the links below. Thanks for watching, and I'll see you in the next video.